If you have a serious spinal injury, there's a good chance you may have to get surgery. The experience may be seen as daunting. It's invasive, risky, and definitely not cheap. Not to mention recovery time. But thanks to one doctor out of Phoenix, there is an alternative. One that is minimally invasive, less risky, and a shortened recovery time. So people can get back to their lives as soon as possible. Well, the man leading the charge with this breakthrough treatment is Dr. James Adkins of Escape Spine Surgery. Doctor, welcome to the program. Good to have you on, sir.
Thank you.
So,
Pleasure.
yeah, no, I'm really impressed with this new alternative way of spinal surgery, sidestepping the traditional route. Can you walk us through what exactly this non-invasive procedure involves and a little bit about what kind of patients you've treated?
Yeah, sure. So the patients we treat are patients with herniated discs, spinal stenosis, patients with severe arthritis that have tried conservative care and it's not working. And those patients, oftentimes, their next line of approach is to have an open spine surgery or potentially a fusion. So the procedure that we use in lieu of that is called an endoscope. And an endoscope is a tool that is about 7 millimeters in diameter, about, say, the size of your pinky fingernail. And that tube is inserted in the spine. It has a camera and it has a light source and a cutting device. And so the surgeon or physician can remove the compression to your nerves without having to do a traditional surgery that involves cutting of the muscles and bones and potentially creating collateral damage and significantly longer recovery time than the approach we use today.
Yeah, with today's economy, doctor, people need to get back to work. There is no off time, no time for vacation even. So this new kind of procedure where you can have the recovery time and get back to doing your day-to-day things, whether that's lifting heavy equipment or having to walk as part of your routine. It's really important to some people. How did this vision come to you? Is this something that you've been working on for a while? I mean, how did this all start?
Yeah, so I've been in this field for 27 years. So we've been in the interventional spine and pain arena for 27 years. So I've had a front row seat to this development. And about 8 years ago, we started using this endoscopic procedure. And what's really elegant about this approach is because you don't have to cut the muscle and the ligamentous attachments in the spine in order to access the spine to decompress it. So instead of cutting through the tissue, potentially leaving collateral damage, we're able to insert the tiny tube into the spine, remove millimeters of tissue versus having to take chunks of bone, or even worse, having to put metal into the patient's spine, which we know can leave collateral damage. So we started doing this about 8 years ago, and we're really happy with this approach. It's a holistic approach. We also have nutritionists on our team. We have manual medicine providers like curated physical therapists and chiropractors that work with patients after the surgery so that the patient gets optimal recovery and isn't left working and trying to figure this out on their own. In spine medicine, patients are often shuffled between providers. There are a lot of specialists work in silos. And so patients are lost in the middle and don't really know where to turn. Should I listen to my spine surgeon? Should I listen to the neurologist? Should I see a chiropractor? Should I have a physical therapy visit? So we coordinate that all in one practice, and it's a safer approach for the patient.
So that's great. So the patient is kind of hands-free. Let the doctor and the team do all the heavy lifting, all the work, so you can sit back, relax, and enjoy the minimally invasive spinal ride, if you will. So what do you suggest for someone experiencing symptoms of chronic back pain? I work in news. I'm sitting basically 90% of the time that I'm here. I have a lot of my team, my directors, even the editors. We're all just sitting. So, the compressed spine thing comes into play here. So what do you suggest for someone with this kind of pain? How can we alleviate to even begin this, to avoid pain altogether, really?
Yeah, perfect question. My first advice would be to move as much as you can. If you were to come to our clinics, you would see even in our administrative offices, we have standing to sitting workstations. If you can go from a sitting to a standing position throughout the day, that's a lot healthier for your spine. So that would be one piece of advice. But movement is great medicine. So if you have chronic back pain, don't be afraid to move. The worst thing you can do is to sit for too long or to maintain one position for too long. So moving throughout the day is vital to keeping your spine and your discs healthy. But if you haven't had a visit with your family doctor and considered a physical therapist or a chiropractor as a first line approach, exercise, that's the best place to start. Interventional spine physicians are a great resource too. And then only if that stuff doesn't work would you want to seek out a spine surgeon, because you don't want to put a tack in the wall with a sledgehammer.
Absolutely. We've also seen, doctor, a spike in opioid addiction and people with chronic pain. Are your patients able to live pain-free without this pain management medications and such things related?
Now, I wish that was the case with every patient, but it's not. Like I said earlier, I've had a frontline approach. I've been watching this since 1997 when Purdue was coming in our office saying that there's no ceiling for opiates. But the reality is, we take patients off of opioid medication on a daily basis. Many patients that have been utilizing opioids for years are really shocked to find out that there's an ultra minimally invasive approach, like an endoscopic spine surgery, where they can have this procedure, walk out, have a Band-Aid placed on their spine, and literally be back to work within a day or two. So there are really elegant solutions for patients today that we didn't have 25 years ago when the sketchy marketing started happening with Purdue Pharma.
Interesting. And what about insurance? Are people able to, do insurance companies cover this type? I know it's a kind of a newer way of looking at things.
Yeah, a lot of the cutting edge procedures we use, whether we're using regenerative medicine, where we're using a patient's own platelets, or we're using their own cells to try to repair tissue, or endoscopic procedures, a lot of these procedures aren't covered by insurance. There are some carriers that are starting to cover these procedures. That Medicare now has a code, but it really depends on the region you're in as to whether you can get this type of coverage, whether you can get coverage for those cutting edge procedures. Most of the time, unfortunately, they're not covered. A lot of it is private pay with patients. And these legacy treatments that have been covered by insurance, like fusions and epidural steroid injections, we still utilize those treatments. But the more innovative procedures sometimes take a while before they're covered with health insurance.
Interesting. Well, hopefully, knock on wood, I never have back pain, but if I ever do, I'm going to go to you, Dr. James Adkins. And, while I'm down there, Phoenix, beautiful city. So might as well enjoy both, right? And lastly, how has business been? Because Melissa, who has connected us, said that people are flying from all over to come see you.
Yeah, we operate on patients from Asia. We operate on patients from Europe. We've done these procedures on many patients from Canada, our neighbors. So we see patients from all over the world for these procedures. It's a sought after treatment. Our physicians and surgeons are very busy. We're blessed. We're happy.
All right. Well, I'll catch your more of your stuff on social media. I see you put a lot of new information out there for people wanting to seek this kind of treatment. So I think it's great work what you're doing and spreading the message. All right. Dr. James Adkins, founder and CEO of Escape Spine Surgery. Thanks again for coming on tonight.
Thank you.